Welcome to the University of California, San Francisco Sports Medicine Podcast, featuring Dr. Nirav Pandya, Dr. Brian Feeley, and Dr. Drew Lansdown, discussing hot topics in sports medicine and society. We hope you enjoy our podcast and look forward to hearing from you.
All right, welcome everyone to the UCSF Sports Medicine Podcast, 6 to 8 weeks with myself, Dr. Nirav Pandya, Dr. Brian Feeley, and Dr. Drew Lansdown. Today, we'll be talking about some of the hot injury topics in the NBA as the teams are getting ready for their stretch run towards the playoffs. There are lots of injury concerns that teams have, particularly here in the Bay Area with the Golden State Warriors. So maybe, Brian, I'll start with you. One of the returns where everyone has been following very closely has been Klay Thompson. He's obviously been playing very well, but he has been having some off nights. What should we expect in terms of ramp up and things we should be concerned about for Klay over the next 20 games as we get ready for the playoffs from an injury standpoint?
So when you say off games, meaning he hasn't played as well, or that he's just taking some off nights, or both?
Both, a little bit of both, about the rest nights as well as when his performance, he can go for 31 game and then next game, next 2 games later have, 7 to 8 points and seem a little bit off.
Yeah, I think one thing to think about is all players have that. So that can have nothing to do with injury, probably can have a little bit due to fatigue. So if you haven't been playing nearly as much, you're going to get a little bit more tired out. As your legs get tired, you're not going to shoot as well. But that's probably some of the ebb and flow of a normal NBA season. I think the protected rest is really important. We know that when people have more rest, they're less likely to get injured. And certainly with fatigue, somebody coming off 2 injuries, trying to protect Klay as much as possible for a playoff run is really important. And as I'm sure we'll talk about with the other injuries, they're in a perfect place to just kind of chill and stay close enough to the Suns, especially with Chris Paul out, try not to let Memphis catch them. But there's no reason to gun for any records in the regular season at this point.
Yeah, no, I think it's important because a lot of people will see a great performance from him and expect that to happen every night. But, to understand just the period of time he's been off, you can't expect sustained performance at that level. And in general, just hard to do that in the NBA. So absolutely, I think we're going to see those off nights, particularly as he's still only, 20 to 30 games into his comeback. Now, someone who hasn't been back for a while is James Wiseman, Drew. And, he had this meniscus procedure back in April and had a secondary procedure to quote unquote clean out an issue with his knee. When someone's returning to play off of a general, let's say maybe first from a, kind of quote unquote clean out procedure, what are the things that you're looking for in terms of getting an athlete in terms of return to play?
Yeah, so most of the time we're looking for like full return of strength, coordination, balance, and then you also have to build up endurance and just all those complex movements to get back into playing elite level sports. But yeah, generally the strength is what we will look for first, and then for somebody like Wiseman too. I would just envision that return being challenging. Like he's so raw to begin with, like so much talent, but so little experience that, he's somebody that seems like would benefit from more playing time in general. And then it's just going to be hard to get as he's, trying to regain that endurance, that ability to play a full game and, play at that level.
Well, one of the things they were concerned about after, the cause of secondary procedure based on what was reported was kind of swelling in the knee. What are the different things that can cause swelling, this far out from a procedure that would be concerning?
Yeah, with a lot of swelling, we're always concerned about either a re-tear of the meniscus or a potential cartilage injury. Those two are the structures within the knee joint that they'll cause the knee to blow up anytime you load the knee. So like I go for a run, I have a lot of swelling afterwards. Most commonly, it's either meniscus or cartilage. So that could be, some smaller tear of the meniscus that, most of it's healed and then just trim out part of it. Could be some breakdown of the cartilage, something like that, is just scoped, cleaned out. But the swelling is usually a concerning signing for us during the recovery.
Absolutely.
Yeah, I went for a run yesterday with a 7-year-old on my shoulders, and I can tell you that increased load causes knee swelling if you have a prior cartilage or ACL injury. Nirav, I think especially after last night's game when there was I would say, I don't want to say defensive collapse, but let's just say the Mavs played really well in the fourth
totally
quarter. Fair. A lot of the talk online was about we needing Draymond back. What is his prognosis? Why is it taking so long? Or is it really taking a long time? Is this what should be expected?
Yeah, no, yeah, absolutely. The team clearly, needs his defensive presence and kind of the glue that he brings to the entire team. I think in general, we think about herniated discs, in his back and causing the calf pain. I mean, number one, I think people need to understand this isn't just like, oh, I threw my back out, my muscles are sore. I mean, this is a structural issue based on what's being reported by the team, where the disc has basically caused inflammation. It's irritating the nerve root, and that's impacting, the strength in the calf. So for that process of the body to physiologically, decrease that inflammation, have the nerve recover, and then gain the strength back can take several weeks. So absolutely, I mean, you talk to people who do a lot of spine work or spine surgeons or people who do, kind of treat athletes with this kind of injury. I mean, 6 weeks is a minimum you're looking at to make sure that this inflammation goes down. Because unlike, say, like a calf or an Achilles muscular injury or a tendon injury, once that nerve gets irritated again, it can be another several weeks for a recovery to happen. So I think in general, what you're looking for is pain to go away, his strength to come back. And then the factor that's the hardest to predict is how is that back going to respond to impact? So you don't want to ramp someone up too quickly and then cause re-aggravation of symptoms. I think the good news is that there's been one study that was done several years ago that looked at NBA players who had disc issues, and about 70 to 75% of them returned to play. And there was really no difference in terms of their performance afterwards. So once you get these athletes treated well, there's a very high likelihood they'll perform very well. The hardest thing is determining how Draymond will do in terms of the contact based on the type of style that he has. But taking additional time, I think, is really important to make sure this doesn't get re-aggravated, because if it does, then you are worried about whether this will mean the end of the season for him and him going down the surgical route.
Yeah, I think it's been a really good sign that he's not, at least the reports say he's not complaining of back pain, it's leg pain. And that tends to be people who do better, at least in the everyday population. People who have leg pain with a spinal problem tend to do better than my low back hurts. And historically, those patients tend to respond better to treatment, get back a little bit sooner. I know there's a Twitter-based anesthesiologist that has pretty strong thoughts on whether or not Draymond should be playing or not. But hopefully he'll be back pretty soon. Now, Drew, I wanted to ask you about Chris Paul, since the Suns are ahead of us by 6 games, but are losing a little bit. First of all, why are there 2 UCLs in the upper extremity? There's one in the elbow and one in the thumb. And what do you think about Chris Paul's injury?
Yeah, so a good question on the first. And so both are the ulnar collateral ligament. So that's the Tommy John ligament when we're thinking about the elbow and our pitchers. And then also ulnar collateral ligament at the thumb. And, I think the reason for the name is just, so in the forearm and the hand, the 2 bones in the forearm are the radius and the ulna. And usually we'll just reference everything based on those bones. So whichever side it's on. So it's on the ulnar side. So that's where it gets its name from. Same with the elbow. And, that's a tough injury. He has an avulsion fracture, I think it's been reported. And so that's where just a fleck of bone is pulled off with the ligament. And that ligament is important for keeping the thumb in position, especially anytime the thumb is hit. So keeping it from moving side to side, like windshield wipering. Anytime you're pushing off with your thumb or catching something, you would have force across that area. You can imagine with dribbling, shooting, passing, like everything he does would be stressing that area. What
about State Farm commercials? Do you think he can still do those?
He will probably still put those out at an impressive level.
Okay.
Yeah. But I think the current plan is for him to have a cast. If the bony piece is in the right spot, then you immobilize the thumb and that should heal. If it's moving at all, if it's not healing, that's where the role for surgery comes in. But it is something that sounds like it should be able to be treated without surgery. But that's one where you really can't stress it too early, because as soon as you do, then you push that piece apart and then it just doesn't heal. And then the thumb's not stable and you don't have that same power in the hand.
Yeah. It's interesting why, people always bring up Jimmy G out here in the Bay, and Jimmy played, with this injury. I mean, obviously we don't know the exact injury pattern between the two of them, where none of us are taking care of them, but is it different for a quarterback who may only be using that thumb, 30, 40 times a game versus a point guard, in terms of why, one may need to be shut down, another one can continue to play?
Good question. And I think probably some of it's like the timing for Jimmy G. Like I would imagine if, if this were the NBA Finals, it may mean that Chris Paul tries to push through a game or two. It probably wouldn't be effective. And I think we saw that with Jimmy G towards the end, but that may or may not be related to the thumb. I think the best way to treat it without those external pressures is definitely to let it heal first before pushing back. And I think the other interesting thing with Chris Paul is he tore his left UCL, like 5 years ago? And then now dealing with the same thing on this side. So, something about him, or I guess just his aggressive style of play has probably set him up for both of these.
Yeah. No, obviously, if you look at kind of there's history of how many injuries Chris Paul has had to his hands, it's pretty remarkable. And, for someone who's trying to get a lot of steals and diving, definitely placing those hands at risk. Now, kind of shifting to the other end of the spectrum in terms of NBA players at the center position, Brian Zion has been dealing with what was reported as a fifth metatarsal fracture. Apparently, it hasn't been healing well. He's been shut down. I mean, is this something you commonly see in athletes that will have a bone that doesn't heal after surgery?
I think it depends. So realistically, no, most bones heal. We tend to think about bones. If you're going to injure a bone or a ligament, you'd rather injure a bone because the healing rates are going to be much faster. The one that always comes to mind is that tibia fracture in the NCAA with the open fracture. That kid still came back and played 6 months later. Fifth metatarsal fractures are fractures at the base or the part closer to the ankle of your pinky toe. So this isn't way out at the end of your pinky toe. It is right at the base where it kind of turns into your hind foot. Now, these are an important fracture because most of your weight when you go to jump goes through that area, and there isn't a very good blood supply. And if you add in the amount of force that somebody who's 6'10", 6'11", over 250 pounds is going to put on that, it's an area that once it's injured takes a really long time to heal, and it's really hard to put increased weight on it. The good thing is we've seen this in NBA players, and people come back from this all the time. When you look at Kevin Durant, he came back from this. One of the great Stanford Cardinal alums, Robin Lopez, came back from it in 2009, playing for the Pelicans also. So the fact that it hasn't healed isn't necessarily an uncommon thing. And I think they're probably doing the right thing by being conservative with it. It's not like the Pelicans are going anywhere this year. So hopefully giving it more time to heal, sometimes even doing a revision surgery can be more predictable in terms of getting him back. But the important thing is they're getting serial x-rays. They're making sure he's completely healed before letting him go out and put stress on it.
Yeah. In, another kind of more kind of conditioning based injury, and we'll talk about Durant's MCL a little bit later, is the return of Ben Simmons. Like everyone's concerned about what Zion will be like when he comes back after a long layoff, if and when this foot fracture heals. Ben Simmons currently right now, obviously with the trade, is trying to play. But currently there was a report listed that he's dealing with back soreness due to the fact that he hasn't been conditioning for a while, and they need to strengthen that area up. For an athlete returning to high level play, Drew, with these various issues popping up, why is it important to get these issues addressed early on for an athlete, even someone who's very elite like Ben Simmons?
Yeah, with something like soreness in the back, issues like often we'll think of like hamstring strains, things like that, especially as people are ramping up. And it's as soon as you just push through it, ignore it, that's when it often turns into that more chronic issue where now you're missing time on a weekly basis rather than just letting it recover, working through it, and then kind of figuring out the problem, treating it, and then getting to full strength. And I think it's tough for him to try to ramp up like towards the end of the season like this, where everybody's getting into playoff shape essentially, and he's probably in that preseason condition. But to be able to like fully ramp up, give the time you need, there's probably pressure on joining a new team. I think everything about his situation is interesting. But it'll be interesting to see what happens, with the back. I think so little is known too right now exactly what it is. I think they're saying it's just some soreness, but that could always mean other things as well. Hard to interpret at this point.
Yeah, apparently it's from carrying Kyrie's bags up and down. He lives in a walk-up in Brooklyn, so it's
There's
just
a lot of bags there.
steps.
A lot of bags.
And in Philly, he had an elevator, so it's hard to know. Yeah, I also think we shouldn't discount the mental part of it. So when you look at Ben Simmons' history, not in a bad way, but he's dealt with some mental issues while he's been playing in the NBA. Giving him the right time to be mentally in the correct space when he plays, I think is totally reasonable. And I kind of wonder in the next 5 to 10 years if we're not going to see a true transition to fewer games played in the NBA, even if it means less revenue, because the NBA medical staff, players, agents, and even to a large extent, the owners are taking more interest in the health and welfare of these players. And I think we're learning more and more that giving players rest and the kind of mental and physical recovery that it takes to play in front of 15 to 20,000 fans every third, fourth night is a big deal. I want to ask Nirav, since he is an expert in pediatric MCL injuries, what should we be expecting about Durant? We tend to talk about MCLs about, oh, this is a minor injury. Well, you get back, you don't need surgery for this. Is it taking him a long time? Should they be conservative? What's normal? What do you tell your patients?
Yeah, no, that's a great question. I think we have a tendency to think, oh, it's just an MCL, not a big deal, not a big deal. But, it's one of the major ligaments of the knee, and it does provide some degree of stability. So, and it's an injury that Durant did suffer as well when he was with the Warriors. Steph Curry also had a similar injury as well, too. We see it a lot in NBA players and NFL players. I think in general, when you think of an MCL injury, it's important to understand even if it's a sprain, there is some degree of actual tearing occurring. Grade 1's a microscopic tear, grade 2 is a partial tear, and grade 3 is a full tear. And really the only time we do surgery is when it's associated with multiple other ligaments being torn, or if it's kind of torn off the tibia. But in general, I tell my patients if it's a grade 1, meaning it's a microscopic tear, typically it'll be 1 to 2 weeks. What you're looking for is you need full motion, full strength, no swelling, and the fact that you can actually do agility maneuvers. A grade 2 can be more along the lines of 4 to 6 weeks, and a grade 3, which are rare, then you're talking about 3 months. So, in general, it seems like most NBA players kind of fall in line with a grade 2 injury, which is kind of right where Durant is in terms of that 4 to 5 week kind of recovery time point. And the thing is, because it gives stability to the knee and he's a player that moves side to side, you want that injury to heal appropriately so he doesn't get another injury. I mean, the classic thing when he was coming back from his Achilles, he injured his hamstring. And what you don't want is this pathway of injuring his knee, then injures his Achilles, and then he's kind of out for the playoffs. So it's better for them to obviously be safe. They're integrating new players in, and he's right where you would expect most, kind of elite level athletes to be with this kind of injury, assuming it is kind of in that grade 2 timeframe.
Yeah, and we saw this, I think, in the 2016 playoffs with Steph. He injured himself in the first round, and it took him, I think, 2 weeks to get back. And he came back, and he was, I would never say somebody's a step slow in the NBA, but he wasn't quite himself when he first came back, but he was able to play himself into it. I think people often ask, like, is there increased risk to the knee ligament structures when you come back? If you have an MCL that's sore, are you going to tear your ACL, or should we be exceedingly careful?
Yeah, I think so. I mean, I think you want to make sure that there is no degree of soreness, because when there is soreness or pain, that means that ligament, in my eyes, is not structurally doing its job. And then you're transferring stress onto other ligaments in your knee as well as the meniscus. So I think it's important for this to be completely pain-free and to have that stability. Now, in some athletes who may not necessarily be cutting and pivoting as much, let's say like a football lineman, sometimes you'll say, look, we'll stabilize you with the brace to give you that external stability while the ligament heals. But for a player like Durant, you depend so much on cutting and pivoting that you need to be pain-free to even be that athletic and to do what he does. But also you don't want to risk that injury to other ligaments or, cartilage, meniscus inside the knee.
Yeah, I think for most athletes, I think sending them back in a brace is totally reasonable and probably does decrease that other injury risk. But you really don't see players come back in ACL or MCL braces in the NBA. And I think even some faster cornerbacks, wide receivers will come back for the first few weeks with an MCL sprain, just because the cutting isn't so repetitive when you're playing in the NFL compared to the NBA.
Yeah, exactly. I think it's the nature of the sport. You're constantly moving around, where football is for the most part more linear, and not as continually cutting and pivoting as well too. So absolutely. Well, that was a lot of NBA questions. As the season begins to wind down and the playoffs can begin to ramp up, we'll definitely have more questions, particularly as player health becomes more important for playoff seeding and playoff performance. But we thank everyone for listening to our podcast, and we look forward to having you listen in the future. Thank you.